Assalamu alaikum and good evening. Welcome to another program of Health is Wealth. I am your host, Shabnam Riaz. Today we've got a very, very important topic that, really needs to be discussed. Something that, sometimes you feel that in our part of the world, not enough importance and not enough emphasis is given, a priority is given to this issue. And the issue we're going to talk about today is mental health. Something that is so important. And for that, we have our expert who's with us here today in the studios. We're very happy to have Dr. Amir Malik Sajjad, consultant psychiatrist, executive medical director for mental health organisation Navigo. You're here from the UK. Thank you very much for being here today.
Thank you for having me. Assalamu alaikum.
Right. Okay. So before we speak to our expert about these issues, we're going to show you a quick report.
Mental health includes our emotional, psychological and social well-being. It affects how we think, feel and act. It also helps determine how we handle stress, relate to others and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Over the course of life, if you experience mental health problems, your thinking, mood and behavior could be affected. Many factors contribute to the mental health problems, including biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, family history of mental health problems. Mental illness refers to a wide range of mental health conditions that affect mood, thinking and behavior. People go through periods when they feel emotions such as stress and grief, but symptoms of mental illness last longer than normal and are often not a reaction to daily events. When symptoms become severe enough to interfere with a person's ability to perform day-to-day chores, they may be considered to have a significant mental illness. Sadly, prospects for care are exceedingly bleak, as many patients never seek treatment, quit prematurely, or are shunned by family members.
Okay, welcome back. Now, Dr. Amir, you have the advantage of, seeing things here in Pakistan, working in the UK as well. When you're here in Pakistan and you're here on a professional sort of a visit as well, and when you're assessing the mental health issues, and of course a person makes a comparison that happens subconsciously, do you think that in Pakistan people are giving enough importance and priority to their mental health? Are things improving?
Well, I think it's very unfortunate. Mental health is something that is not been really recognized, and it carries a lot of stigma, and that's an issue across the world, probably more so in Pakistan, but the Western world also carries the same problem. Not everybody is so forthcoming trying to present their issues, and being kind of diagnosed with a mental disorder is considered to be as a label of a mental disorder. That's very unfortunate, because we have to really look into that. Mental disorders are not crafted. They are not people put on themselves. It's more like when you're developing a physical health disorder, you've got no control on that. Similarly, mental disorders can develop. Problem is a poor recognition, and the people do not volunteer to come forward and speak about their mental health issues. Probability of mental disorders in our country, in Pakistan, is massively high. And the most leading disorder in this part of the world, especially in Pakistan, is anxiety and depression.
Right.
But we need to be careful on recognizing whether it's a disorder or it's just an emotional reactivity, because every human has to respond to stressful.
Emotional beings.
Absolutely.
Yeah.
So being happy when it doesn't really mean that you would not develop a mental disorder or would not develop a low mood, but you really need to be careful before diagnosing somebody. And I've got loads of colleagues who are working as experts here. We actually have got general recognition. Mental disorders are actually not really something that people want to talk about. I think investment in mental disorders or improving mental health can definitely be looked into at the state level. And that's what's happening all across the world at this stage.
Right. Right. Now, you mentioned, the stigma behind it as well. It's probably the stigma as well that is leading to people, not seeking professional help and not sort of being proactive about it, not being assertive about it, because they have this sort of, fear of being, as you said, labelled with something. So how do we work towards, breaking that?
As I said, just in the last few minutes, you do not develop physical illness by yourself. Okay, it comes on. It is the nature is that human body is adaptive to changes. Sometimes that change could be counterproductive, and this is where the physical health disorders come up. Exactly the same for mental disorders. People also kind of say, well, I don't want to be labelled as a mentally ill or mentally unwell, because then there would be a general opinion about me that I'm not ever going to be getting well. I'm not ever going to be like having a very successful life. Might become risky or dangerous to others. But that's not the case, because every human body has got their own potentials. They've got their own issues and risks. So a mental disorder does not really mean that you are not going to be well enough later on in life. It's early detection. Early detection, early management always brings out very good results. And this is what we should be doing. Our social media, our news channels, our kind of printed media, wherever we can actually try to educate people that mental disorder has got the same level of impact on somebody's life as physical health is. And we have to be more acceptance of that.
Right. That's very true. Okay, now you mentioned anxiety and depression, and you said there's a lot of incidents of anxiety and depression in Pakistan. How often does that go undiagnosed? How often do people sort of self-diagnose themselves and imagine that they have depression where it might just be mood swings? And what are the causes and the difference?
Okay, it would be a slightly longer answer. I mean, as I said, mood reactivity is very common. We have to have mood reactivity. If we are just blunted or flat all the time, that's not good enough. That's not human being. So being a human being, you have to show emotions of being happy and need to show the emotion of being stressed out or depressed. But a disorder is when that thing is impacting on your life, on your family life, on your professional, if you have got any vocational activities. If it starts impacting on that and it has to be present for some time, then yes, that is a diagnosable mental disorder. And at that stage, you should be able to kind of come out and say, yeah, probably I need to get myself looked into. For example, we across the world, there are two major classification systems for mental health disorders diagnosis. One is called DSM, Diagnostic Statistics of Mental Health Disorders, and other one is ICD-10, it's International Classification of Diseases. Mostly European countries and in UK, we tend to use ICD. ICD tells us that if we haven't got the symptoms of such called low mood with the associated symptoms of lack of interest, lack of energy, guilt feelings for up to 2 weeks or more than 2 weeks, that's not a diagnosed mental disorder. That is a one-off episode that has developed and might go away without treatment. But if somebody is going through those kind of things, as I said, for longer than that, definitely they need to be getting themselves slightly more careful about that there is a mental disorder that is treatable.
Right. What about anxiety? What are the symptoms of anxiety?
Anxiety has got a long spectrum of things. Anxiety can be related to a situation you are in. That is called phobias. People have got different types of phobias. Some people do not feel like going in open places, or some people really feel very anxious when they actually go into closed spaces. People are sometimes kind of phobic of being in the social kind of situation called social anxiety, social phobias. So that's very kind of reaction to certain stimulus. If there is no trigger and still you're feeling anxious, and you're feeling anxious without any reason for most of the time of day and night, that is called generalized anxiety disorder. It could be just a feeling of being unwell, something we call catastrophic thinking that something bad is going to happen at some stage. So that actually is generalized anxiety. But then there's an extreme form of anxiety when for no apparent reason there would be very severe physical manifestation of anxiety disorder. That's called panic disorders or
panic attacks.
Panic attacks or paroxysmal anxiety disorder. and people can get any kind of symptom that might mimic a heart attack or going blind or not being able to walk, and it's usually short-lived, it goes away. But the problem is...
But then they live in the fear of having another panic attack.
Exactly. So your predictability is so poor in that, that you are always in the fear that when it's going to happen the next time.
Yeah.
And when it happens, it is severe enough for you to be really worried about your physical health. So I mean, anxieties are very much attached to underlying depression most of the time. Anxieties can happen.
Okay.
And that's why most of the anxiety disorder treatments are actually linked with depression. Most of the medicational treatment or pharmacological treatments are actually what you actually do for depression. So anxiety goes hand in hand with depression in a lot more cases.
It's usually the both of them exhibiting together. Is it then?
Yeah.
Okay. Now, having said that, are there certain personalities, certain types of a personality that is more prone to getting anxiety and depression? You know, when you hear about people saying, you know, I'm more sensitive to things, I feel things more than other people usually would. You know, how do we classify those?
Yeah, something we call pre-morbid personalities. Always somebody would have some very peculiar personality characteristics, whether they'll be very good in few things, they might be not as good in few things. So we always tend to ask, how do you deal with stressful situations? People who are prone to anxiety disorder, they will always say, I'm a bit of worrier, I tend to worry a lot about things. Then yeah, those people are probably likely to be more prone to getting anxiety disorders. We also need to be careful that nature and nurture plays a very vital role. We are born with few genetic kind of makeups and wired, what we're wired up in a certain way. But then our nurture system, like how the environment is treating us, how we actually go about and get exposed to outer world, how we get a reaction back from outer world, whether there has been any kind of untoward things, that tends to actually make people worry or become sometime into a category of personality disorders. So our environment plays a vital role.
Right.
A good, stable family environment, good parentalhood tends to produce more stability in the later lives and in the adolescent years.
Okay. Yeah, it's a very sort of important point as well, isn't it? That the person that you are, depending on circumstances in life, and because you don't have control over that, but the way you react to them, you do. So what are the things that a person should adapt and sort of adopt in their personalities to make them tougher, you know, and having a stronger mental health? What can a person do for themselves?
Well, I think it has to be a joined-up approach. Coming as a child, as a kid, when we are growing up, I think that's really important. What kind of family environment we are growing up. So if I'm given an opportunity to raise a family, I think I would really like to develop much more attachment with my child. I would like to be a bit watchful on what they are doing, try to develop some dialogue, be in regular contact with your child. That's vital.
Right.
Okay. Even it is like something called very disciplinarian. You are trying to discipline your child, which kids don't like actually. But that's really important because at least you are not detached from your child.
And actually the child will realize that you're caring.
And
you know,
absolutely,
you're concerned.
absolutely, you're concerned. The more time you give to your child, they would actually feel a lot more directed, signposted what they should be doing in the life. And these are the skills they would be required when they become adults and in their child. So one thing that as a family we could do to develop some kind of resilience on ourselves is actually develop a family cohesion. That's very important.
Right.
But at the same time, when we are growing up, there's a lot of things that we can do. Well, I mean, you have to, if you are really worried about something, you need to look into somebody that you are inspired. If there is some kind of counseling, any coaching that could actually develop that skills that you might be lacking. Having a stable physical health also is very important. If you are into a stronger body, the stronger body tends to host a stronger mind.
A stronger mind. So there is a relation there.
That's really important.
Okay, okay.
Yeah.
We've had a couple of questions from our viewers, and one of them is that, you know, how much of an impact does electronic media have on people in general?
Well, electronic media is something that is actually on everybody's doorstep now. So somehow, with even with the kind of electronic media, or with the papers, printed media, or use of social media, that's all really important. That we need to really be careful. We need to be responsible. It's very unfortunate that the news or the occurrence that has got a bit of unfortunate outcome attached tend to get more traction. Okay, so that's we have got loads of responsibility how to really present those
to have
kind
a
of
balanced.
to have a balance, because we are actually, we don't want to develop a generation that is that's kind of has got fear of something that's going to happen, something bad. If we have to be really, I think it's really important, you have to be realistic and do not try to hide the facts. But at the same time, it is really important that a positive message needs to go out. We've got loads of achievements, we've got a lot of things that people in Pakistan are achieving and abroad they are achieving. That needs to be equally posted, so that there has to be a balanced and responsible media approach. Social media, I think it's really important. It depends on how you want to use the social media. There are very good educational sport mechanisms available, groups available that people can actually use. But at the same time, you can use for the wrong reasons.
Exactly.
So, I think I would say nurture is very important. If your child is really exposed to social media, I would really suggest that you need to have some kind of trust in your child.
And also guidance as
and the
well,
guidance for the
to
child.
see, be involved in what they're actually being exposed to.
Absolutely.
Because social media, we see a lot of children, especially in those formative years and those impressionable years, where they're actually, it affects their self-esteem, it affects their sense of, worth as well. When it can. Usually you see this sort of a comparison being made, and feelings of being dissatisfied or envious. And these are things that, when you compare people going on frequent holidays or living a certain lifestyle, how can that affect mental health?
Well, again, if you are more attached to your child, you can actually tell them what realistically is achievable and what's their direction or the target goal should be in the life. If the child is exposed to something that is very, very unrealistic, not achievable, that is actually creating a sense of kind of feeling deprived or not being able to achieve it, or sense of inferiority. That can only be kind of overcome if the parents are actually developing dialogue. I think my emphasis in the last few minutes been. The more you are detached from your child, the more the child is in isolation, it is likely that you might not get the full potential of your child in the later life. So it's good that you need to be.
You have to be involved.
You have to be involved with your child.
You have to be, you just have to know what's going on and what's crossing their mind and what they're being exposed to. Very good point. Okay, we have another question. Can a lack of good nutrition be a cause of weak mental health?
Yeah. Physical health has to be perfect, and vice versa. It goes hand in hand, that you have to have a good health, physical health and the mental health, and similarly for a good physical health, you must have a good mental health. Lack of nutrition or sedentary lifestyle or poor nutrition carries a lot of kind of consequences for later life. Okay. I think the issue that we actually see mostly is obesity that we have seen. How much do we actually tell our kids to have a certain BMI? Not to kind of trump the balance, because we don't want a generation to develop with eating disorders. But we need to kind of tell them this is normal BMI. You need to work in that body mass index to get full alertness in yourself. Your brain equilibrium and your brain receptiveness increases when you've got good nutrition. But good nutrition doesn't mean that you should be eating junk food, because that has got extra non-healthy components in it.
Right.
Mostly obviously it's the excess of carbohydrates, which our Asian community is quite used to of, and fats as well. Something that we have to really look into is a balanced diet. That's really important. Along with diet, physical health, physical exercise, that's important. The more we become used to of doing it from early ages, that carries a long way.
Right.
So your physical activity tends to actually release endorphins that tends to make you a lot more relaxed.
The happy hormone.
Happy hormone. At the same time, I think when you are physically tired, your sleep pattern will be nice because your body would naturally be looking to get enough sleep. And then obviously a good sleep actually gives you a good alertness the subsequent day. So physical health is important. Nutrition is important. Low BMI or excessive BMI, obesity, tends to actually get a lot of problems in the form of getting not being being misfitted with the rest of the colleagues or in colleges or universities. Negative self-esteem develops. Bullying attitude can develop. You cannot actually really say that it's going to be it's the same across the board. But this is how people actually tend to get a lot more stressed out if they're not fitting physically well in their colleagues or in their peers. So you have to really look into all of those things.
Okay. Another question we have is the link of undiagnosed hypothyroidism in women who are presenting with depression.
Thyroid is something that we tend to always check as either to rule out or establish if there's a problem, somebody who's presenting with depression. Depression can present as an outcome of a low thyroid. So instead of then, I wouldn't really go on to treat depression, rather I should be treating the thyroid because underlying cause has to be treated first.
Right, okay.
Thyroid is important at the same time for being hyperactive because hyperthyroid tend to have picture which might actually mimic quite a bit of bipolar disorder when you are actually high or elated mood or mania.
Right.
So amongst the baseline investigations, amongst everything else that we know about system, kind of ruling out any systemic issues, it is really one of the fundamental things that we actually check thyroid because thyroid balance is required, not underactive or hyperactive thyroid.
Okay. And for another question that we have, premenopausal women, will it differ in case to case whether they're going to have hormone replacement therapy or antidepressants? Is that something that is decided upon in an individual case?
Yeah, sadly there is no one fit for everything. So
Right.
absolutely you're right. It has to be individual case. Sometimes we actually tend to try not to start treating with hormone replacement therapies. Rather, we say we have to really treat mood symptoms. And at the same time, we would really struggle to get the outcomes if we are not treating the underlying cause, if the menopause or premenopausal symptoms are leading to mood disorder. I think the best approach would be, it has to be a collaborative approach, so our gynecologist and our psychiatrist, they need to have a dialogue amongst themselves
and
look
would
into
decide
they should decide the best outcome.
better option.
Sometimes you
Okay.
might have to have a combination as well.
Of both, right? Okay. You're speaking about bipolar disorder. It's something you hear a lot about. What exactly is it, and what are the symptoms?
Fine. Bipolar is like you got two poles, two extremes. One pole, which is down below,
Right.
is like feeling quite severely depressed, and the other high pole is when you're feeling too happy, too elated, too euphoric. Again, you have to try to get to even keen on that. Yeah, so it's have to somewhere in the middle. If somebody gets symptoms of a severe low mood or just under low mood, but at some stage they actually become very high with not only in mood, but also they've got some reckless attitude. They become careless in their spending. They become full of energy, not able to sleep, not actually requiring sleep, not getting tired at all, and sometimes people sadly can go on for days and days without sleeping, and can develop some grandiose ideas as well, where people might think, well, I'm special, I'm different, I'm not doing it. Superheroes. Sadly, if that happens, it has become very difficult to bring them down. Why? Because if somebody is really happy, why would they want to come down? So they lack the understanding, they lack the insight, and this is where we have to be watchful on what's going on. If they are just high energy and too happy, it's called hypomania. But if if we leave it untreated, it can progress into something called mania. And manic is when psychotic symptoms kick in, and people can actually start getting kind of very out of touch with reality.
Okay.
And in that case, it becomes more like a psychiatric emergency. You would have to really aggressively treat to bring them down.
So what is the treatment for bipolar disorder?
Well, bipolar, usually, as we are saying, it is going. These are massive mood swings, going from being very low to very high. The treatment is you will treat the episode. If somebody is high, you would like to bring them down. If somebody is depressed, you would like to bring them up. But there's a chance, there's kind of concern that actually it might revert them into other into opposite pole or opposite episode. You have to always treat them with a mood stabilizer at the same time. So you would treat depression or mania, but unless you have got a mood disorder cover, then it is going to be a more like swinging pattern. So you have to really consider mood stabilizers.
Right, okay. So we'll be back with more on this. Don't change the channel. Okay, welcome back to the programme. Now, before we went to the break, we were speaking about bipolar disorder, and you were telling us about mood stabilizers as well. Do they have any side effects?
Some of the mood stabilizers have got real significant side effects. We have to be really, really careful prescribing. One of the first line treatments as a mood stabilizer is sodium valproate, or any form of sodium valproate. They can come as Epilim, Chrono, or there are Depakote. There are different formulations. But these should not be given to the women of childbearing age, because if a mum-to-be is getting this medication in the first 3 months of pregnancy, in the first trimester we call it, it's very likely that there would be some kind of effect on the child. Especially the worst are neural tube defects. That means their neurological functions cannot fully develop. So we actually tend to kind of say no valproate for childbearing age. There are other safer options. Lithium is one of the medication which is it's kind of is gold standard for bipolar disorders across the world. Even in Europe, we tend to use that. We have slightly drifted away from lithium because lithium has got problems with pregnancy as well. So I would really advise the mums to be careful. Lithium should not be taken. They can cause something called Epstein deformity. The medication is again got issues. People who have got kidney problems or who tend to become dehydrated, lithium can have problems as well. We've got safer options. We've got carbamazepine, Tegretol, and antipsychotics drugs that can be used. Yes, they've got every medication has got some potential to cause any problems as well. So always please you refer to your expert or prescriber who has got expertise to advise what's the best for you.
Right. Okay. So, we're speaking about personality disorders. What about borderline personality? Tell us what that's.
Fine. Personality disorders are. We talked about how our environment affects us when we are growing from childhood up to our adolescent years, how we actually expose ourselves to significant life events, and how do we react to those. I think that comes a lot from what we have observed. If somebody is coming from a background where there was lack of attachment or parental kind of abandonment that we call in other words, if the child has observed issues in kind of domestic violence, or they've been bullied or victimized or anything untowards, if they are not able to release that by speaking to somebody and do not get a quick resolution on those those episodes of unhealthy mental health for that moment in time, they can have scarring for quite a long time. Personalities keep developing from childhood up until adolescent years. So we tend not to actually really diagnose personality disorders till somebody is actually in their early 20s. Some places they're very strict that no personality disorder should be diagnosed before 21 years of age. Why? Because because the personality is still developing somehow. But everybody has got a personality. But where it becomes a disorder is when your personality is somehow not fitting with the cohort of people that you are living in. If any significant life event, usually stress, there are different ways of dealing with stress. People tend to have some transient effect that passes on, but people with borderline personality disorder, they might have a very exaggerated, very kind of impulsive type of response that could range from relationship breakdown to self-harm attitude to having suicidal thoughts, and sometimes actually it also leads to kind of very destructive behavior towards others. So borderline personality disorder is on rise. It's more recognized, I suppose. So if somebody is presenting with very heightened emotional responses to kind of life events, then and especially if it is becoming malfunctioning for them in their family life, in their professional, as we said before, so then you have to think about whether it's a personality disorder of some sort.
So a person with borderline personality, what is their sort of approach to relationships?
We talked about some classification system. The actual international classification of diseases is the name is emotionally unstable personality disorder. Within emotionally unstable personality disorder, we've got a type borderline, and other type is impulsive. Impulsive is that you are acting without thinking. So it's a very kind of a quick response to something, which sadly can be just destructive for somebody, for property, for self, or someone else. The borderline is low self-esteem, having not a lot of respect for yourself and for others, relationship, inability to maintain relationship. People with borderline personality disorder can form relationship, but it is how to carry the responsibility of that relationship. And there are associated symptoms. Borderline personality disorder doesn't mean that the individual will not develop any other mental disorder. Depression is very common. Depression is very common. Anxiety is very common. So you would actually treat what the underlying disorder is along with personality. It's hard to change somebody's personality, but the psychiatric evidence and research has generated a lot of evidence now to look into developing skills that person lacks in those personality disorders. We call DBT skills. These are dialectical behavioral therapy skills, and we have kind of courses where people with personality disorder, they can actually present and be part of those groups to learn the skill to how to regulate their emotions. Something called mindfulness is really important, although it is much more. It's more about validating yourself, knowing what you are, and then trying to see where do you not really fit in, and then start working on those elements. Although it's more for mood disorders, but as I said, personality disorder has got a lot of mood disorder prevalence. I think it becomes a lot more concerning when we see youngsters starting to do things which are deemed to be more harmful for themselves or others. Right. And this is where I think a more emergency kind of response comes in. Try to admit, try to kind of treat, and try to give them some kind of therapy. Well, again, I would say it is the environment, how the environment is developing our kids.
Right. Something you mentioned before as well, people, the mood swings and getting high and being on a high and then bringing them down again. We see lots of youngsters at the moment in the country, unfortunately, experimenting with drugs. Okay. Just because what happens is they're in a group and somebody says let's just see what it feels to get high or whatever, and you'll see that the peer pressure and everything else is happening, unfortunately, in our country too. So what message do you have to youngsters who are being reckless this way? I mean, do they really understand the implications that this has on their health?
I think the message is very clear: stay away from drugs. But why people tend to do drugs, I think that's important. There's loads of debates, loads of discussions. What happens? The research says that it's not all genetic. people can start drugs for several reasons. It could be abandonment, it could be experimenting, it could be a very rebellious thing to do, it could be just peer pressures, and then something that you say, okay, I'll just see what it's like. It's what we call novel seeking kind of behavior. See what it's like, and then it becomes more like addiction. I would say anything that you are not able to do in front of your parents in your kind of adolescent years, that is something that probably is not right. So that level of trust should be mutually there between your parents, amongst parents and the children. You're right, there are different types of drugs. The most commonly used across the world is cannabis. Different forms of cannabis, some place called hashish, or cannabis itself. And what we have seen a rise in synthetic cannabis, which is a resin of cannabis, and it is very psychogenic. It can actually present with symptoms of schizophrenia.
Okay.
And if somebody has consumed cannabis, they can present with those symptoms, but the cannabis does not leave your body for 4 weeks. So at any stage, if you do a drug test, or usually it's done by the urine sample, cannabis is there usually for 28 days. So depending on how much your body is sensitive to a drug, those symptoms might actually last for that period of time, for that long, and even longer. So that's really important, that we actually stay away from drugs. Cannabis is not something that causes somebody to feel a lot more related. It's more like calming, and people trying to kind of say, we are trying to suppress something which is uncomfortable. Speak to a health physician, speak to somebody you can trust who can give you right advice, rather than trying to self-medicate with these things.
Yeah.
Another thing is amphetamines, stimulants, or speed kind of thing. That's something that is very euphoric. People tend to do it because they actually are wanting to feel higher and happier. All the effect is not as long-lasting as cannabis is, but the effect is very disproportionate. People can become very reckless. They can be very careless in what they're doing when they're using these kind of drugs.
Right.
I hope it does not come that way to this country. But in UK, we got a real research of legal highs. So these are the drugs which have got no legal control of the drugs, and they are kind of available under legal highs spectrum, which means people can buy, keep it, but we don't know what's inside there.
Okay.
So don't go for novel seeking. Do something that you can openly talk in your family. That is your protection.
And find the highs elsewhere. Something that won't harm you in such a way, and then put you up for such complications, because that's the main thing there.
And don't self-medicate. Try not to start treating yourself by actually with kind of somebody has told you something.
Now you're talking about self-medication. We find a lot of that here in Pakistan, because what's happening is that you'll hear people saying that, I was really tense, I couldn't sleep, or I was feeling restless, and then somebody will say, okay, now take half a tablet of this, and it's usually for anxiety or whatever, and you find people are taking them on a regular basis.
Well, over-the-counter prescriptions or over-the-counter obtaining of medications, I'm quite kind of satisfied. Things have really moved on, and a lot of responsible pharmacists, they do not actually dispense medications. There's no way you can do those kind of medications in the Western world, especially in the UK, where I come from. So yeah, do not try to do that, because I think the most common thing which people probably start medicating themselves for is the insomnia or lack of sleep.
Exactly.
And the most common medication that people tend to get from over-the-counter is some kind of hypnotics, or benzodiazepines, clonazepam, diazepam. Obviously, there are different names how these are manufactured.
Right.
Ativan is very common. Okay, we are not against those medications if they are responsibly used. And when I say use it with responsibility,
and when they're prescribed by a medical professional,
yeah, when I say,
instead of just listening to somebody else's.
Absolutely, as long as you can go to somebody and say, what is okay, I've been told this might be good for me, but is there any problem with that medication as well? So I think you need to understand that human body is working on equilibrium. So your body would actually come back to equilibrium. But if you try to self-medicate, then you are actually shattering that equilibrium. So you really need to work with somebody who knows what they're telling you. problem is these hypnotic medication, if you continue to use it on each night, if you're doing it for sleep purpose or for anxiety, that's again very commonly used, you can become addictive. And then it becomes much more issue, because addiction means that the medication that was giving you a good effect lost that, and you have to double up the dose, and it keeps going on, and then the body is tolerant to that medication. And tolerance means now you're not getting the desired effect, but you can't live without that medication. So it's important that you work with your health professional before you start self-medicating.
Right. You mentioned insomnia. Insomnia seems to be, something that's affecting more and more people. What are the causes, and what is the treatment?
Okay. What we tend to do, we call sleep hygiene. That's the treatment. And sleep hygiene, how we keep our sleep clean.
Okay, that's a very interesting term, sleep hygiene.
Why insomnia happens? Several reasons. Most disorder, like one of the core symptoms of depression is alteration in sleep pattern. Mostly it is lack of sleep. People tend to actually get not enough sleep. It can be a sequelae, or it can be a cause of depression as well. So if somebody is depressed, you would actually see some changes in their sleep pattern. If we just step outside of the mental disorder, why people do not get enough sleep, yes, there could be times when people are actually, the mind is so full of thoughts that they're not letting it go to sleep.
They're not able to switch off.
So they're not able to switch off. In those cases, this is where sleep hygiene kicks in.
Okay.
You have to really look into what was the best time you got a good sleep, and what was going on at that moment in time. We tend to tell people, do not keep the lights on. If you are like aiming to get good sleep from 11 o'clock onwards, most individuals, most humans should get about 8 hours of good sound sleep. If you're aiming for 11 o'clock, try not to take anything that can stimulate your body, like coffee or tea or any of the stuff that might actually make your body a bit more alert. Try not to watch TV for that long, because it might be, it keeps your mind switched on. Sometimes people actually go for some kind of bath to actually relax their body. That's good enough. Some people actually do use warm milk, because it can actually settle some of your kind of indigestion kind of issues. But the best thing is, know your body, know yourself. How did you get the good sleep, and why are you not getting now? Work on that. Most stimulation has to be switched off. Your lights, your TV, your coffees, your tea, and you really need to work on that. Smartphone, definitely, yeah. A lot of light comes from the under the pill.
And then you're interacting with people as well through social media. And
social media
as well
is brilliant if you use it for good reasons. You might be talking to somebody who's living in other part of the world, and it might be morning for them, but it's your sleep time.
Right.
So you would actually not have the same problem across. So you might be actually trying to satisfy your peer by trying to engage in a very good conversation, but that's your sleep time.
Right.
So you really need to regulate yourself. Sleep hygiene concept is much more developed in the Western world. Not everything has to be treated with a medicine.
Right, and that is, I think, would be the best way to, if you can overcome something without having medicines and do it the other way, then that would be best. Okay, we're running out of time right now, but there's a question I really, really wanted to ask you, so if we could briefly touch upon that. The feeling of loneliness, exactly what is that?
Okay, I mean, we have to be really careful what loneliness is like. If somebody hasn't got a family and they are lonely, I think that is probably explainable.
That's a physical loneliness.
I mean, if somebody is like they haven't got a family and they're living alone and they are lonely, then that's that. We don't really need to try to kind of label it in that way. Okay, what loneliness to me is, it is like more isolation. Why somebody is psychologically isolated.
Yeah.
Why somebody is in the middle of a crowd but still at the periphery. Why somebody is not able to communicate and have that level of social imagination where the other person is coming from. So there could be several reasons. And again, I said not everything has to be explained in medical ways, because as we've got personalities as well. If you see somebody who's got a very pervasive pattern of not wanting to mix up with people, they might be deemed as somebody who are lacking empathy, or might come across a bit abrupt, but that's all unintentional. And they might be quite focused and quite engraved in something, and they might be doing brilliant in those things. triad of having social isolation or lack of communication, social imagination issues, and repetitiveness that actually lead them to develop some kind of very successful life. We have to be careful that are we dealing with some kind of autism spectrum. Again, we talk about our sad way of describing mental health is all stigma and incapability, and it's not going to get better. No, that's not the case. If somebody is on autism spectrum, we're talking about somebody who might be very unwell, very disabled for some reason, or very special when they've got real intellectual problems with kind of comorbid physical health issues. But at the other end, we're still working within that kind of triangle of the symptoms we talked about. Somebody might be very highly intelligent, normal IQ or above normal IQ. There might be Asperger's or Asperger's in some places they call it. And this is again somebody who might say is very introvert, very isolated, very lonely, or sometimes very unfortunate way of saying loner. That's not the case. They might have got a personality of being focused on something and not being able to kind of do social ways of doing things. Again, it's not as such a disorder. It's our personality maker. We should not try to change it. What we tend to do, we actually try to, if somebody is presenting like that, try to get yourself diagnosed. That's important.
That's the key thing.
And that actually serves a purpose for your families, for your potential employer or potential teachers or universities or wherever you are, because then people would say, fine, this person is not deliberately doing things, rather this is what they are, and we should not try to change them. So
absolutely. Absolutely. Dr. Amir Malik, thank you very much for being with us here today. Unfortunately, we've run out of time and there were just so many questions, but of course, you know, such a vast issue and there's no way you can do justice to it in just 1 hour. But thank you so much for everything that you've shared with us today.
Thank you very much. I hope you found it useful.
Definitely, absolutely. So here we are at the end of our program today, and there were just so many things to talk about. You know, it's hard to cover everything in 1 hour. There's no way we could anyway. But so many tips were given to us by Dr. Amir. So many, you know, so many things that we can actually relate to and understand. And if you have, you know, you find that you are having any of these problems yourself, or a member of the family, a loved one, friends, do encourage them to seek professional advice rather than having people, you know, self-medicating or diagnosing themselves. So until next week, stay happy, stay healthy. Bye-bye.